cruised through 6-2, 6-3, 6-3 to extend his winning streak to 23 matches. He'll now face American 5th seed Taylor Fritz, who beat Russia's Karen Khachanov in 4 sets. Meanwhile, in the women's draw, Aryna Sabalenka fought past Germany's 104th ranked Laura Siegemund in a nearly 3-hour battle to reach the semi-finals. The world number 1 dropped the first set and was a breakdown in the deciding set before winning 4-6, 6-2, 6-4. Sabalenka will now face Amanda Anisimova in the semi-finals after the American beat Anastasia Pavlyuchenkova 6-1, 7-6. In football, Chelsea are through to the Club World Cup final following a
Get ready for less pain, faster recovery on how modern surgeries are changing the game with our experts on Good Morning Doctor, brought to you by Mount Elizabeth Hospitals. It's possible.
Good morning.
Welcome to the morning show.
Yeah.
The Big Show with Glenn and Angel on Kiss 92.
Good morning.
Sometimes getting out of bed in the morning is a lot to deal with all at once.
Good Morning Doctor is back, and I'm so excited because this is my first Good Morning Doctor after coming back from leave. I know last week we started Good Morning Doctor again, right?
That's right, yeah. So it's our second session after the holidays.
And this week we have Dr. Loong Tse Han, General Surgeon from Mount Elizabeth Hospital, and accompanying him to the Big Show studio this morning is Vidya, daughter of Veerapandiyan. Good morning.
Good morning.
Good morning.
Good morning. So Dr. Loong, just to get your designations right, you're a general surgeon from Mount Elizabeth Hospital, and Vidya, you're a senior physiotherapist from Parkway Rehab. Right. And today we're talking about what the medical industry is calling our body's hidden support system, the pelvic floor muscles. And I think these are muscles that we barely think about. So doctor, maybe first question to you. Most people, as I said, don't think about their pelvic floor muscles until maybe something like incontinence comes up, or maybe something else that you will tell us about. So what exactly are pelvic floor muscles, and why are they so important?
Right. So I think the way to look at it is that in the body you have the abdomen, which holds some of the critical organs, mainly your intestines, your stomach, and that the abdomen is bounded at the top by the one sheet of muscle known as a diaphragm, and at the bottom you have a similar sheet of muscle called the pelvic floor. It keeps everything up inside the abdomen, and it's hidden because it's at the bottom. So most people don't think about it; they don't see it because it's an internal structure.
Oh wow!
Okay.
I like the explanation. It's the opposite of the diaphragm. It's at the bottom, holding things up.
So, when we go to the gym, for example, and we do leg raises, does that help the pelvic floor muscle?
No, that's a very good analogy. So basically, it's as with all muscles, you need to exercise. As you know, when you're doing certain exercises, you use certain sets of muscles. So unfortunately, when you do leg raises, you don't necessarily use the pelvic floor muscles a lot. But there is sometimes you do need to brace your abdomen when you're doing certain exercises. Yes. So that actually. You do need to contract your pelvic floor a little bit to increase the pressure and support the abdomen as you're doing it. So there is a little bit of component involved when you're doing leg raises.
Yes.
But it's not directly exercising that muscle.
I see.
Okay. So when it comes to men and women, because you say it's kind of the opposite of the diaphragm, it holds everything up. Are our pelvic floor muscles built the same?
Technically, the muscles are the same. It's
Okay.
the same sheet of muscles. What differs between men and women is the structures that it has to support. And also, I guess if you look at it as a continuous sheet of muscle, in the man you have an opening for the rectum at the back and
Okay.
a smaller one in the front for the urethra for you to pass urine.
Mm-hmm.
In women, you have one additional opening. And that additional opening changes the structure of the muscle in the sense that the strength of the muscle is affected by these gaps in the muscle structure for these openings.
Wow,
So
okay.
women, of course, as you can imagine, having an extra opening
Yeah.
may have a little bit more challenge making sure that the muscle is stronger.
Okay,
I
okay,
see.
all
So
right.
they have to do more pelvic floor exercises, which we will learn from Vidya in just a while, right?
Yes, we will. So what, earlier off air, we were talking about strong, loose pelvic muscles. Well, not loose, maybe not
Tight-
strong.
tight or weak.
Tight or weak. There you go. Thank you very much. Tight or weak pelvic muscles. What are the signs to look out for? And we've heard of weak. How can something be so tight that it affects you?
Okay, so I guess the other thing to consider is that although we're talking predominantly about when we talk about pelvic floor, we think mainly of this sheet of muscles, but the whole pelvic structure actually involves a few muscle layers above it as well that help to hold the rectum together. So one of the problems is the reason it's tight, meaning when we say it's tight, we mean that the muscle is under a lot of tension. The tone is very high. This is usually in a situation where someone's exerting a lot of control over the muscle because the muscle is under voluntary control. So the way I like to think about it is that if you are if you're thinking consciously about trying to poop, then you would try to contract certain muscles. Sometimes we don't, because we can't see these muscles, we contract the wrong muscles and we keep exerting a lot of force on the wrong muscles, and those muscles over time become, as with all exercises, it becomes stronger and bulkier. And if we get the wrong muscles stronger and bulkier, that can be a problem. So you want to strengthen a certain muscle, but not, and have another muscle not be too strong.
Oh, I want my muscles at their optimum. Maybe we can find out from Vidya.
Optimum as in like really
No,
tight?
not tight. Optimum performance. Not tight, not weak.
Yeah, because as you just said, Doctor, if it's too tight, nothing can come out of the anus.
Yeah.
Right? That's what you're saying.
Yeah.
Okay, all right. Let's continue to talk to the doctor on the Big Show TV. Somber is next. This is Back to Friends on Kiss 92. And then if it's too loose, then everything you
Falls
can't
out.
control.
Yes, exactly. So Vidya, we've heard of Kegels. I always thought Kegels were for women, but can you explain a little bit more about how Kegels work, how we can do them, and maybe how men can do them as well?
Let me lie down on that. I'm kidding.
So Kegels exercise is for both men and women. It's an invisible exercise. No one knows that you are actually doing it. You can do it anywhere at your time, like even when you're doing your housework or you're sitting in the couch, you are driving, jogging, any time of the day, anywhere you can do this Kegels exercise. It is basically understanding how to contract your pelvic floor muscle, how to activate your pelvic floor muscle. For this, you will have to imagine that you are peeing and you're trying to stop your pee midstream. So that's the kind of feeling you should get when you
That was
are.
Glenn's face peeing. Sorry.
I'm doing it now.
Yeah, so am I. Yeah.
Yeah. So that's the kind of feeling you should get when you are contracting your pelvic floor muscle. So initially, to start to activate the muscle, you can try and do a quick squeeze and relax. So you should squeeze and you feel a little of lift over there, you hold it and then you relax.
And how long do you hold it? Just a
So
second.
initially, it depends on how weak and how the muscle is. If it's sometimes the tolerance of everyone is different. So if you want to start, you can start from holding it for 1 second, releasing it, holding it, releasing it, probably about 10 times. And then initially, once you understand how the contraction is, and then you can progress by holding it for 1 to 3 seconds and then relaxing it. And you slowly increase the number of seconds you're holding it. That improves the endurance of the muscle.
And how many times a day do you
You
need to
can
be
do
doing
it
this?
like 10 repetitions and 3 to 4 sets a day is sufficient.
I can tell what everybody is doing across the
Yeah,
island
man,
right
right
now.
now.
Everyone's kind of like,
Yes.
their eyes are looking up going, oh, okay, that's how we
Yeah.
exercise.
They're like trying to hold it there, then like, 2 seconds, 3
Every one
seconds.
of-
Okay, the feeling goes away.
All of you in the bus, the MRT, the grabs, everything.
But do not try it in the toilet when you're peeing. peeing because that might cause infection.
Oh,
So
okay.
it is only like you imagine that you are peeing and then you stop it midstream.
So while you're peeing, don't do it.
Yes.
Right.
Okay.
Doctor, are pelvic floor muscles different for men and women?
No, so pretty much the muscles are somewhat similar, but because of the different anatomical organs that you have there, the muscles, you have there's slight variation in the sense that they have to hold different structures up. So in women, the pelvic floor muscles have to support the rectum, the uterus and the vagina, as well as the urethra. In men, it really just supports the rectum.
Okay.
So men usually don't have many problems with the pelvic floor. Although they do get occasionally, they have less problems because of that.
Okay.
I have a question. I mean, I know it's good to have our pelvic floor muscles working at the optimum for things like incontinence and constipation and stuff like that. But what about for sexual pleasure? Because I've heard that Kegels are also good, particularly for women. I'm not sure about men. Is this true?
Okay, so Kegels exercise is, it has various benefits, like it supports the bladder, it supports the bowel control, it also enhances sex. And because this is the main muscle that supports the pelvic organs, and yes, it does, because we are strengthening the muscle and we are also trying to improve the endurance of the muscle. So it does. But if the muscles are already tight, you might not want to overdo the exercises to further tighten it, and so you should seek professional advice on this, like whether to get it assessed, whether it is weak or it is tight, to understand whether Kegels is the right exercise for you.
Can we tell ourselves whether they're too weak or too tight?
I think it's easier to tell when it's too weak. When
Yeah.
it's too tight, it's a little bit harder.
Yeah.
So when the pelvic floor muscles are too weak, then you have a very heavy feeling, because basically it's not able to do its supportive function. So women who have got weak pelvic floor sometimes complain of a persistent heavy feeling at the bottom, and
In the bladder? Or
so they feel like
lower
everything,
even?
even lower. So they
Yeah.
feel like everything is just drooping down.
Right.
And sometimes if it's really weak, sometimes even the internal organs can sometimes come out a little bit. What we call prolapse. So some women, it's so weak that even the uterus can slowly make its way to the opening of the vagina.
Oh my gosh,
And the rectum
wow.
comes out. So that's in the very severe
Right.
cases. But when in the milder cases, they just have a very heavy feeling at the bottom. I guess a good way of describing it, although I've never experienced it myself, when women are pregnant and and the baby
Everything
is really
pushes
heavy,
down.
they feel something very heavy at the bottom.
Yeah.
That's the kind of feeling, because it's not, the muscle's not able to hold things up as well. So that's when it's weak. Of course, you would also have, when it's weak, you also have problems with your function. So you have difficulty keeping the urine in, and also difficulty with your passing motion.
Right.
Paradoxically, when the pelvic floor is weak, people actually get constipation sometimes, because when you're trying to push the poop out, instead of it going straight down, the weak muscle is not able to hold the rectum in a straight position. So they end up pushing very
Kind of
hard.
going sideways.
Yeah,
and-
going sideways, exactly.
Right, okay.
So women usually complain of the fact, not women, most people, when they have this weak pelvic floor, they complain of the fact that they're sitting on the toilet and they're pushing really, really hard. They're exerting all their force until they're sweating and even almost going to faint.
Oh no.
But nothing comes out. The reason is because the poop, instead of coming down, is going to the wrong direction. So that's where sometimes doing some pelvic floor exercises to straighten it up and pull the whole rectum straight enables you to be able to push it out much easier.
Okay.
I noticed many women have issues like constipation and all that. So chances are these women may have weak pelvic floor muscles.
Yes, so that's usually the case, but not always.
I see.
And that's because of the fact that it's easier for the stool to go sideways in women than in men.
Okay.
Okay, we're going to go back on air.
Kiss 92 traffic.
On the SLE towards the CTE before the Woodlands Avenue 12 exit, look out for a broken down vehicle. Also on the KJE towards the BKE, a vehicle's having trouble after the Chua Chu Kang Way exit, avoid lane 1. If you spot anything else, you can WhatsApp us 8855
Good morning and welcome back to Good Morning Doctor, and we welcome Dr Loong Tse Han, General Surgeon from Mount Elizabeth Hospital, as well as Senior Physiotherapist from Parkway Rehab, Vidya, daughter of Veerapandiyan. Good morning.
Good morning,
morning.
guys. And today we're talking about how important it is to make sure our pelvic floor muscle is at its best. And you were talking about one Kegels exercise. Is this the only exercise available for men and women to strengthen their pelvic muscles?
For the pelvic floor muscles, yes, it
Okay.
is the exercise to strengthen it. However, there are other exercises to add support. Like, let's say if you are having tight structures around, and even if your pelvic floor is tight, you first have to relax it and let it go, like kind of release the tension from that area and kind of open up your hip muscles as well to better support the pelvic outlet to pass gas or to to
Okay.
So I would say if someone needs to fart, just fart. don't hold everything in. Right?
Yes,
Right?
indeed. Yeah.
It's like letting go. Sometimes it's difficult when the muscles around are very tight. So they'll be like straining and forcing.
Right.
It's like pushing through closed doors.
Oh,
So
right,
that's
okay.
when,
But
Okay.
can pelvic floor issues cause back pain as well, doctor?
Yes, I guess it can. It's not commonly the main source of back pain because, but of course, when I think that's the main issue is that when you have pelvic floor problems, you're exerting a lot more force in the front, and sometimes you're trying to get into an angle that makes it easier for you to put because you know that you're pushing to the front, so you're thinking, how do I change that? And that is a secondary back pain that sometimes occurs. Of course, the other issue that sometimes when everything feels like it's sinking down is that your posture, your back posture isn't quite optimal because you have heavy feeling. You try to stand in a different position, and so you tend to get back pain from that indirectly, but not specifically due to the pelvic floor, but because you're trying to compensate for issues with the pelvic floor.
So how early on should men and women start doing Kegel exercises?
Kegel exercises is something that can be done anytime. Like so,
Age-wise, though?
Age-wise,
I think I think if all exercises, the earlier you start, the better it is, because and then once you understand how to contract the muscle, because I think that the most difficult part about Kegel is or any pelvic floor exercises is it's a muscle you can't see.
Right.
And trying to train a muscle you can't see is difficult. So I always use analogy when you're teaching children how to kick a ball, you actually realize the ball is there. It's so straightforward. Just kick it straight. But then you realize actually it's a lot more difficult. And this is a muscle you can see. You can and you can already see what you're doing. Imagine doing that in a structure that you can't see. You have to imagine that there's a muscle there. You have to imagine it. So the tip that Vidya gave about the urine, that's one of the best ways of trying to visualize
It's
it.
perfect, actually.
Yes,
Yeah.
But besides that, most people don't really know how to contract the muscles, which is why a trained physio is usually the best person to see, because they can target which muscles and tell you how to contract the correct muscles and when to relax the other muscles. So those other muscles are harder to convey over speech. Is more something that you need to show and say, okay, you want to press this muscle and you this is the muscle you need to contract.
Yeah.
But Vidya gave a good tip. Don't
Yes.
do it mid-pee because you might end up with a UTI instead, right? Like an infection.
Yeah, but why would anyone do it?
No, well, I mean, they're practicing. Someone is listening to us right now,
That's
trying
true,
it
that's
on the
true,
loo,
that's
you know.
true.
So
This is so useful because, I mean, look, we are of this age right now, and whoever's listening to us, now they know how to do Kegel exercises. So as they grow older, they can just continue to do it as and when.
they become second nature. Like you just do it when you think of it. Yeah.
It's like, well, I'm still doing it.
Yeah,
right
same.
now. I'm so afraid I'll overdo it, and tomorrow I'll be aching down there. Anyway, it's 8:22.
Kiss 92 Time Check by Pu Tian.
But that's a good point. How much is too much, though? You
Yeah.
know, like for us who think, our pelvic floor muscles are sort of regular, we're not too tight, not too weak. How do we know we've overdone it?
Okay, so if you are feeling like you cannot let go of gas, or if you're feeling like you're straining too much in the toilet,
That's too much.
Yes, that's too much actually. So just keep it to like 3 to 4 sets a day and do it like 10 repetitions every day. Sometimes if the muscles are quite weak and you want to improve on the endurance of the muscle, it is fine to do it. However, continuously overdoing, the muscle also gets fatigue. So once the muscle gets tired, you will know that you're overdoing it.
So will the
Okay,
muscle
I better stop right now.
Like will Glenn wake up tomorrow with an ache? That's what we want to know.
So it's a natural thing. Like once you're feeling tired, you will
stop.
immediately stop it. Yeah, just
Okay.
listen to your body. If you're
Right.
tired, you just stop. So going beyond that is overdoing it.
Okay, got
Right.
it. Okay.
Once someone can once someone knows you're doing it just by looking at your face, yeah, you're overdoing it
You're
as
kind
well.
of sitting there going, hang on, I need to do 5 more sets. Okay, so doctor, we understand that you're trained in minimally invasive and robotic surgery. Now, what is the difference, if we can ask, between a conventional surgery versus the less invasive and robotic ones?
Right. So basically, when we do an operation, the traditional way we do it is through an open incision, because before we had the advent of all these technological tools that enables us to get really close with cameras and equipment. We had to do it the traditional way, which is just opening up and doing a surgery that way. So the incision in a traditional approach is usually a lot bigger. But now with a lot more equipment, we are able to make smaller cuts and still have good visualization, because we have better cameras, small cameras, and also equipment that is a lot more dexterous. So minimally invasive surgery basically just means that the outside opening on the skin is a lot smaller, and also it means that by doing that, we actually reduce a lot of stress on the body, because the body doesn't imagine it as being such a traumatic injury.
Then the scar also doesn't have to heal, which is
Correct.
another thing on its own, right?
Exactly. So the healing is a lot better, not just on the outside, but on the inside as well, when we do minimally invasive surgery.
Is there surgery for pelvic floor muscles?
And it's very good that you ask. So actually, that's what I spent a year overseas learning about, on how to do surgery for the pelvic floor. So basically, one of the structures that goes through the opening, the rectum, is obviously it's held by the pelvic floor. So what we can sometimes do is to anchor the rectum and pull it up. And so in other words, you support the pelvic floor by pulling the rectum up a little bit, and then anchoring it deeper inside in the abdomen. So you provide another additional set of muscles
From somewhere else
to support the pelvic floor. So you help pull it up, and so you give it a buttress to improve the strength of it. So yes, there are surgical options. Fortunately, most people don't need surgical options. Most of the time, just as simple exercises, or sometimes not so simple, more complex exercises from the physiotherapist can correct a lot of the cases. So more than 80% of my patients, they come to me with issues with constipation or incontinence. Usually after just correcting the diet and after some physio exercises, they usually get better without needing surgery.
Okay.
All right.
And when do they need surgery? I mean, what's happening in there that they would need it?
So I guess when the pelvic floor is really, really weak and
Not doing anything at all for them.
Well, even if it is doing, but not being able to you can't really strengthen it. Sometimes you after all the exercises, like some people, when you do lots of bicep curls, the bicep doesn't get any bigger, it just stays the same.
Yeah.
So some people, no matter how much they train, or they're not able to give the length or number of reps as what Vidya suggested, or sometimes even the more elderly patients where they have a lot of difficulty trying to squeeze the muscle that they cannot see, and that's when sometimes surgery might be indicated, when the muscle is so weak and there's no good way of strengthening it with exercise.
Oh, okay. Good tips for our parents as well.
For people who are trying to do Kegel exercises right now and they don't feel anything, that's also a sign that they have weak pelvic floor muscles, right? Like if they can't, like we are telling them right now, it's like try to hold, like the feeling is to hold your pee in, but they can't even do that. They don't have a feeling at all. Does it mean the person has weak pelvic floor muscles?
I think not necessarily. I think it just means that because it's hard to actually get that sensation. So when you actually get it right, then you realize, okay, so now I know that this is
something
how
is happening.
It's supposed to feel like. But before that stage, there'll be a lot of people who'll be, because it's when you're trying to squeeze it, sometimes you just don't know which muscle to squeeze, and that's the biggest challenge, learning how to squeeze it. So Kegels is easy to describe, but to actually do it some of the more complex pelvic floor exercises, those are also similarly even harder to learn. And so when there's that difficulty learning how that sensation feels like. So sometimes just if you don't feel it, doesn't mean your muscles are necessarily weak or too weak. It just means that maybe you haven't had the right coach to teach you how to squeeze that muscle. So some patients might benefit from seeing a physiotherapist to say, okay, I'll show you how it's supposed to feel like, by activating the muscle. And once you know how that sensation is like, it's easier to replicate.
Right.
I'm just curious because when I first heard of Kegel, I always thought it was for the front of the female anatomy. But I realize now it goes across the whole bottom bit. How big is this muscle? Like, what are we looking at?
Front meaning what, Angel?
The front of the female anatomy.
Oh, okay.
Yeah, not the back as well, because that's what it benefits as well, right?
Oh,
the entire bottom.
Yes.
The entire bottom. So how big is it? Does it cover your hip to hip, or how?
Yes. So it does cover
Hip
pretty
to
much
hip, okay.
pretty much the entire hip. So I guess you can imagine as about the size a little bit smaller than an A4 sheet of paper, because it goes all the way from the front of the pubis to the back to the tailbone.
Okay.
So it has to cover that whole structure down
And then
there,
side to
and
side.
all the way to the sides.
Wow,
yes.
so it literally is like a whole floor.
Yeah.
Just there. Wow. Okay. So it is a very, very important structure.
Yes.
To keep optimum.
And when you're doing the Kegel exercises, you should also try and feel a wider area as well, is it? Not just one small area.
You should feel the squeeze and lift. That is what you should feel.
Squeeze and lift. Okay.
Yes.
Yeah. Because as you get stronger, I'm just feeling like I can feel more of the muscle than I did when I first.
Yes, that's how you're supposed to feel.
Okay.
Yeah. Okay.
I don't want to do too much as well. Okay, we're going forward.
Back on air.
Yeah.
Kiss 92 traffic.
On the SLE towards the BKE, look out before the TPE exit because an accident has been reported. Also on the AYE towards the MCE after Jurong Town Hall's exit, avoid lane 3, another accident. Finally on the SLE towards the CTE, a vehicle's broken down after the TPE exit, avoid lane 4. Stay safe.
Welcome back to The Big Show and The Big Show TV. It's Good Morning Doctor Day, and we have been having a great time speaking to Dr. Loong Tse Han, General Surgeon from Mount Elizabeth Hospital, as well as Vidya, daughter of Veerapandiyan, who is a senior physiotherapist at Parkway Rehab. And today we've been talking about the pelvic floor muscles.
Yeah, and we have Mol that came on our Facebook page to write a comment saying, I was taught pelvic exercises in my prenatal training over 20 years ago, and it still comes in useful. That's a good tip for mothers to be and even new mothers, right?
Yes, that's right. Yeah. So I think that's the good thing is you need to have the training before prior, because it's easier to remember to learn it before you actually have all the weight that you need to support during the pregnancy. So it's actually very good. So it's something that we try to encourage more women to learn before they get pregnant.
And let's say they are pregnant now. And women tend to have a little bit of incontinence while they're pregnant because of the weight. Is it okay for them to be doing it while they're pregnant as well?
Yes, to be safe, get assessed by a physiotherapist because they will teach the position and how to do it for pregnant women. And there's a period of time where they can do it and they should stop doing it. Just understand how the muscle works. So, yes, it is safe, but still get the physiotherapist to assess.
Okay, that's a good tip. Yeah.
Wonderful. Thank you so much, Doctor, for being here with us this morning. It's been a pleasure. See, time has just flown by just like that. Half an hour.
Yeah, thank you so much for having me.
Thank you so much, Doctor. And thank you very much,
you.
Vidya,
Thank
for
you for
coming in
having
as
me.
well. Thank you. This has been Good Morning Doctor.
You've been listening to Less Pain, Faster Recovery on how modern surgeries are changing the game with our